Hello everyone, my name is Kevin Fufam, and today I'm going to present the heart failure prediction for my big data class. As you all know that nowadays people are extremely busy and hardworking in order to meet their life needs. This prevents them from taking time for themselves and causes stress and mental illness. Additionally, there are some indications that the global coronavirus pandemic causes heart problems in cardiac muscle inflammation. As a result, heart disease is quite common today, and the primary motivation of this project is to figure out which models using machine learning technique to predict the heart failure rate, and the project also examines which factors are highly correlated to death event of a person using visualization. So the content of my presentation will be included the first part, data overview, exploratory data analysis, data preparation, data encoding, modeling and evaluation, model tuning, conclusion and limitations. First, let's look at the data overview. The dataset contains 13 columns with 299 observations, and there are non-categorical variables, and most of them are integer and float. So for example, you can see here in the table age, the data type is float, so the sample value is 75, 55, 65, or anemia is integer value, or we can say binary value because it only contains 0 and 1. And we have diabetes is also the integer and binary data type. It contains 0 and 1 value. Now let's do some exploratory data analysis. So the table shows some variables have outliers. For example, you can see the creatinine phosphokinase has outliers because of its max value is 7,861, which is way larger than its 75% value. Similarly, platelets also have outliers because its max value is 850,000, which is more than double of the value of the 75%. The serum creatinine variable also has outliers because of the same reason, which is the max value is more than double of the 75% value. Now let's look at the first part of the data visualization. So from the data set, the number of the males is more than females, and there is a significant difference between the two genders. The number of males is almost double the number of female in the data set. It means that the result of this report may only be correct for the males. Now let's look a little bit further into the smoking versus death event and versus gender. So in this graph, the light blue represents the number of females, and the dark value represent the number of males. In this bar chart, there's not much difference between men who smoke and do not smoke. The death event is quite the same to both of them, but in contrast, the percentage of death women who smoke almost triple the percentage of the one who do not smoke. Therefore, smoking can be a potential cause of that leads to the heart failure of women. Now let's look at high blood pressure versus death event. According to the bar chart generated from PySpark, the average number of death event caused by heart failure who's diagnosed with high blood pressure is more than the number of death event who's not diagnosed with high blood pressure. Therefore, high blood pressure is also the potential reason that caused the heart failure for both male and female in the dataset. Now let's look at the gender versus smoking. So in this bar graph, this shows the possibility of death when smoking between males and females. There is not much different in the possibility of death in males who smoke and do not smoke. Unlike males, it is surprisingly that the possibility of death for female is more than double compared to the ones who do not smoke. Therefore, we may conclude that smoking is an important factor to assess the death event for females. And let's look at this graph. Is the serum creatinine versus death event. So in this graph, the relationship between serum creatinine and death event is shown. So serum creatinine is to measure how well a human being kidney filter the waste out of the body. So a higher level of serum creatinine means that the kidney is not working well. So basically in this graph, most people who have high level of serum creatinine have high average of death event, heart failure. Therefore, serum creatinine can be a potential cause of heart failure as well. So before we go into machine learning part, we have to do the data preparation. So this data set is a little bit small with only 299 observations, and it was very clean by Cargo, so there is no typing errors, duplicate rows, or missing values found in the dataset. And most variables in the dataset specify whether a patient has a specific symptom of disease or in a good and healthy condition, including anemia, diabetes, high blood pressure, serum creatinine, sex, smoking. For these variables, a simple label encoding was conducted to transform yes and no corresponding to 1 and 0, and 0 means false and 1 means true. And since the dataset is small, we allocated 80% of total observations to the training set and 20% of that to the test sets. Apart from that, we divided the dataset into features and a single label, death event, and series. So in the modeling and evaluation part, we try different methods, both traditional statistical methods such as logistic regression and other newer tree-based models such as random forest and XGBoost. The metrics for evaluation of the baseline models are listed in the table. Although the tree-based algorithms perform extremely excellent on the training set, it has poor performance on the test set. That implies the tree-based model are inclined to overfitting. In contrast, logistic regression did not glow when it was applied to the train set, and it showed a very small difference in terms of performance between applying to the train set and the test sets. Therefore, we can conclude that binomial logistic regression is the best model to address this specific issue. So, with the fact that the underlying problem of the dataset is to predict whether a patient will suffer from a heart attack in the future or not, recall overrides precision, as the cost of not being able to find a person that will get the attack is much higher than classifying health problem as possible patients. So as can be seen in the table above, proceeding with the logistic regression as it performs best and change the threshold for the classifications. Once the threshold reaches to 0.75, the obtained result of the tuned model is listed in this table. It is clearly stated that the neurologistic regression sacrificed some precision, but being successful achieved a recall of 100%. That means the model has the ability to find all the possible observations that will encounter with a heart attack. At the same time, the precision is 74%, which is acceptable. So in conclusion, logistic regression outperforms other advanced tree-based models, and high blood pressure, smoking, serum creatinine are potential reasons that cause heart failure. So while doing the project, we face some limitations. First, the dataset is small with only 299 observations. The result can be more correct if we can collect more observations to increase the efficiency of the report. Due to the time constraint, this result can only be generated from PySpark. If we have more time, we could do it with AWS Jupyter Notebook platform. And thanks for listening to my presentation.